My knee is painful off and on, and my doctor says I'm close to bone on bone. How do you know when you should have surgery? This is a great question. I get this from a lot of different types of people, including hypermobility. And when you've had a joint issue for a while and you've got x-rays that show cartilage degeneration, thinning, your bone on bone, that is a hard thing to know. Do you get it done right away? Do you try and put it off? There's some people that say, wait as long as you possibly can. I tend to kind of take a stance that's a little bit more in the middle and has a little more specific guidelines. What I like to tell people, if you can no longer walk normally, so I'm not talking about just after you've really overdone it or at the end of a really tough day, but if most of the time you're limping, you're compensating, you're walking funny, and how you know is if either you can tell it yourself that you're limping or your friends and coworkers are regularly asking you why you're limping, those are all signs that you need to do something. Because once you get to that point, then now you're putting other things at risk. So if it's your knee, if you're regularly limping, you're now putting your hip at risk, your back, your ankle, and we don't want to make something else worse trying to save a problem area. The second thing is that if you are making decisions based on your joint rather than based on what you want to do. So for example, if my knee is supposedly bone on bone, if I am deciding not to see friends and family, if I'm deciding not to go shopping, not to go to a party because it's going to irritate my knee too much or I can't stand that long, those are decisions where I'm not making choices based on what I want to do. I'm making choices based on what my knee will do. And that is a concern because we always want to focus on function. We want you to be as functional and as active as you can be in your life. And so if that is holding you back and you're now making those other decisions, you want to look at getting that fixed. We're also assuming that you have tried doing some strengthening or PT, or you've tried some conservative care to get that better. And if you haven't, then I would highly recommend that you do that for a month, not indefinitely, but you do it for a month to see, is that going to change where I'm at? And if the answer is no, and you have those other things, then you really need to talk to your doctor about if surgery is going to be a good option for you. If you are someone who your x-rays show that you're bone on bone, but you don't have any pain, or your pain is just occasional, and you can still walk normally most of the time, you're still doing the things you want to do, then you absolutely do not want to look at a surgical option, because even routine surgeries, you have an option for complications. You have an option for problems. You don't want to take on that risk if you don't really need it. And I have had clients in my office who have been told that they are bone on bone, and we've been able to rehab them and they do really well. And 10 years later, they're still not having pain, they're still not having issues. Well, then you might be bone on bone, but your body's handling it fine and you keep going. Now, someone else with those same x-rays, could do the same thing and not do well and need to have something done right away. So it is an individual thing, but I would encourage you to kind of look at those couple of things. Can you walk normally? Are you making decisions based on your joint? And have you already tried some conservative measures? If you're still having issues, then definitely continue to have that conversation with your surgeon.